Hello, my name is Joel Straz, Health Officer with the Bay County Health Department, and today we'll talk about students going back to school. And we'll further discuss guidance from the Bay County Health Department, especially as we see increases in cases from the Delta variant. As a parent of 2 school-aged children, I share the concerns about the health and safety of our children in the school setting. And I also believe that it is in everyone's best interest to have children attend school in person without interruptions due to outbreaks and quarantines. And while we cannot prevent all diseases from happening, we as parents, caregivers, educators, and the community can all do simple things to prevent our kids from getting sick or spreading the virus. The health department has met with the schools since the middle of July to help them prepare for the coming year and has provided extensive guidance on smart preventative measures to stop the spread of the virus in the classroom and throughout the school. We have highly recommended several strategies, and we'd like to share these with you today. First, get yourself vaccinated and your child vaccinated if they are eligible as soon as possible. Persons who are fully vaccinated are much less likely to be infected and spread the virus, and even less likely to suffer from severe disease, hospitalization, and death. If you want to avoid the unnecessary cost and suffering due to the virus, I ask you to get vaccinated as soon as you can if you are not already so. Communities with lower vaccination rates have seen a greater proportion of children and adolescents with more severe illness from the virus, so please take that into consideration. Second, put on a well-fitted, high-quality mask in indoor public settings, including the classroom. Numerous studies have documented the effectiveness of masking to prevent infection and to stop the spread of the virus, but not all masks are created equal. The best type of mask to wear that prevents infection is an N95, but these masks are relatively expensive and they are not intended for children. There are inexpensive, high-quality masks available for children, such as the KN95, KF94s, or 3-ply cloth masks. These masks provide better coverage, especially if they're worn correctly. Paper masks also provide a level of protection, especially if they are worn correctly. Masks that are worn incorrectly, under the nose or strapped under the chin, provide no protection at all. Third, but equally important, is the amount of ventilation in the classroom. Numerous studies have shown that more ventilation a building has, the less likely a transmission of the virus will occur. Simple strategies such as opening windows and using HEPA-based air purifiers can also decrease virus transmission in classrooms. Cohorting, or grouping students together to avoid widespread mixing of students inside, is also effective. Cohorting, however, is difficult to accomplish in facilities where classes usually mix, like middle schools and high schools. Cohorting is also difficult to accomplish in congregate settings such as lunchrooms. It's also important to have persons and students distance and not huddled together in tight spaces. Ideally, 6 feet distance is recommended, but as we noted, it cannot always be accomplished. Furthermore, distancing alone, especially in enclosed rooms without ventilation and without masks, will not stop the spread of the virus. Our final strategy to help mitigate spread is testing. In May, the Health Department instituted a program for close contacts that helped them avoid quarantines, provided they were tested on the first 5 days past exposure and then on day 7 and day 9. This program was enormously successful. It kept more than 98% of identified students in school and allowed them to participate in extracurricular activities where before they would have been quarantined. More importantly, it helped us identify and isolate positive cases immediately before exposure to more close contacts. This program is now being adopted in similar fashions in other counties in Michigan as well as Massachusetts and Illinois. Not one of these strategies alone will fully stop the spread of COVID-19, but these measures together are strongly effective in limiting the spread of the virus. If you are concerned, please take the time to talk to your school administrators and teachers to see what measures are in place to mitigate transmission and keep your children and teachers safe this school year.